So this is the outline of my talk. We'll review what conventional ICSI is and what are the indications and what are the results and outcomes with the use of the technology. We will look into what piezoelectricity is and what exactly is piezo-ICSI. And we will finally review the evidences comparing conventional ICSI versus piezo-ICSI. So ICSI, or intracytoplasmic sperm injection, is an assisted reproductive technique that's mainly indicated for male factor infertility. And this involves injection of a single immobilized sperm that is then aspirated, and the sperm is eventually injected into the zona pellucida into the ooplasm. So for the purposes of this talk, we will pertain to conventional ICSI, a CICSI, as this methodology. Conventional ICSI is one of the most widely used ART procedures in the world, involving as much as 70% of IVF cycles globally. Locally, I think we're much more than that. We approach 90%, more than 90% ICSI in our cycles here. So as I said, the indication mainly for ICSI is male factor infertility, but there are non-male factors for which the procedure is indicated, such as unexplained infertility, low oocyte quantity and or quality, advanced maternal age, previous failed fertilization, if the patient is going to undergo pre-implantation genetic testing after in vitro maturation, and for cryopreserved oocytes. So the factors with an asterisk after the factor actually presents with data that actually shows that the conventional ICSI is superior to to just plain IVF. Okay, so what are the outcomes when we use ICSI? Comparing this to the traditional in vitro fertilization. So for our colleagues here, in vitro fertilization pertains to the process of putting a single oocyte in a microdrop containing 100,000 sperms. And this is quote unquote the more natural way of fertilization, because these 100,000 sperms are going to compete to fertilize that singular oocyte. And the outcomes with conventional IVF fertilization rate, that is, amounts to around 60%. So that's the standard, but the benchmark is actually 75% or above. Now, intracytoplasmic sperm injection, or ICSI, involves the injection of the sperm inside the cytoplasm of the egg, and this results in 65% fertilization rate with a benchmark of at least 80%. So the conventional ICSI technique uses a spiked beveled micropipette to penetrate the zona pellucida and the oocyte membrane. The cytoplasm is then aspirated into the pipette to facilitate membrane breakage, and the spermatozoa is deposited into the oocyte. The forces involved in penetrating the oocyte and breaking the membrane can lead to deformations of the oolemma and increase internal pressure, leaving the oocyte susceptible to damage after injection, namely lysis and degeneration of the embryo. With all of these factors, there are certain identified disadvantages of using conventional ICSI. Although it accounts for 70 to 80% of IVF cycles, there has been a note of increased rates in degeneration and abnormal fertilization post-injection. And why is this? Because within the ooplasm, or the cytoplasm of the human oocyte, the ooplasm contains various organelles and structures, including mitochondria, endoplasmic reticulum, Golgi apparatus, ribosomes, and it also features elements like the cytoskeleton and vesicles and remnants of the spermatozoon after fertilization. So the mechanical penetration of the zona pellucida with the aspiration of the internal oocyte membrane leads to increased internal pressure, leading to adverse effect in fertilization and blast development. Take into consideration, for example, older women who have, of course, obviously older oocytes. And these older oocytes will have lesser mitochondria. They will have cytoskeleton abnormalities, which predispose them to chromosomal non-disjunction. And if you compound that with a procedure such as the conventional ICSI, it actually may lead to increased degeneration and less utilizable embryos. So now let's talk about what piezo-ICSI is. Piezoelectricity. Piezoelectricity is the ability of certain materials to generate an electric charge when subjected to mechanical stress, and conversely, to deform when an electric field is applied. And this phenomenon is a result of the coupling between the material's mechanical and electrical states. The term piezoelectricity comes from the Greek word piezin, which means to press. So this is the setup for Piezo-ICSI. It is an advanced form of ICSI, and it was first demonstrated in the 1990s by Kimura and Yanagimachi, first in the 1995 in mouse oocytes, then followed by Yanagita in human oocytes in 1999. So this first photo shows us the setup of the Piezo-ICSI. You have the foot switch, the operation box, the controller, and the driver unit. And this middle photo takes a closer look at the injection needle with the drive unit attached to the needle beside it. And through this technology, as you can see, there are a lot of piezo pulses which are converted to quick, precise vibrations in the tip of the needle. Yan, no? So marami siyang vibrations. Okay? So in other words, the needle produces a drilling effect that is used um, to do the ICSI itself. So to break down the techniques involved in Piezo-ICSI, first is the sperm is immobilized. Okay, so the sperm is immobilized. After immobilization, it is aspirated, and then it is ready to be injected into the oocyte. Then the next step would be the penetration of the zona pellucida or penetrating the eggshell. Okay. And then finally, through one piezo pulse, it is able to break the egg membrane and introduce the pipette inside the ooplasm to release the sperm. So comparing this to conventional ICSI, here in conventional ICSI, you can see that the needle is sharp, and this causes you will need a bigger amount of force to pierce the shell. And note that the shell contents have to be sucked into the needle to break the egg membrane. In contradistinction with piezo ICSI, there is no such extraneous movements or pressure inside the ooplasm. Okay, so to summarize what the benefits of Piezo-ICSI are compared to conventional ICSI, a blunt needle is used instead of a sharp needle. And when the pipette is injected into the ooplasm after penetrating the shell and the membrane, it does not lead to distortion of the egg. And finally, it does not need to suck out the egg contents to deposit sperm. So now that I've shown to you the potential benefits of Piezo-ICSI compared to conventional ICSI, is it clinically relevant? So let's look at the evidence. So this is a randomized multicenter sibling split trial, which look into the fertilization rates of mature oocyte cohorts that were divided and were injected using conventional ICSI, while the other half was used using Piezo-ICSI. And the main outcome was fertilization rate after injection. And the result of this study favors Piezo-ICSI. However, take note that the population is only 108. But significantly, it showed that the fertilization rate is better for Piezo-ICSI. The oocyte degeneration rate is less for Piezo-ICSI, and there's more better quality blastocysts compared to conventional ICSI. So what about for poor prognosis patients? This is a small retrospective trial paired within the patient. There were 72 patients who had previous conventional ICSI with poor outcomes, such as low fertilization of less than 50%, high degeneration of more than 15%, and or poor embryo development and utilization. So the intervention done was Piezo-ICSI, which resulted in significantly higher fertilization and lower degeneration compared to conventional ICSI. But more importantly, pregnancy outcomes were examined, and both in fresh transfer and frozen embryo transfer, the clinical pregnancy rates and the live birth rates were better for Piezo-ICSI. So what about Piezo-ICSI for women above 35? So this is a prospective cohort of 947 mature sibling oocytes inseminated with either Piezo-ICSI or conventional ICSI. And that study showed no significant difference in fertilization, survival, or blastocyst development rates between the two insemination treatment groups. However, a subgroup analysis in women with more than 35 years of age showed a significant increase in fertilization and significant improved blastocyst development rate in the Piezo-ICSI group compared to the conventional ICSI. So in alpha IVF, all of the lab systems are equipped with Piezo-ICSI. And when I asked our scientific director, they've been actually using the technology for 13 years already. And based on the internal data generated with the labs, Piezo-ICSI showed the lowest degeneration rate of 1% and the highest fertilization rate of 89%. So this is a study presented in Aspire by one of our embryologists. This is a retrospective study of 535 cycles comparing conventional ICSI with Piezo-ICSI. And the results show that Piezo-ICSI compared to conventional ICSI had significantly higher fertilization rates and lower degeneration rates. How vaccination rates and blastocyst usable rates had a favorable trend towards the use of Piezo-ICSI. So just to give you a scenario, if you have a patient with 20 viable eggs, if you use Piezo-ICSI and you inject them, because 89% is the fertilization rate, you expect 17 embryos. And if you assume that the blastulation rate is 55%, you will have 9 usable embryos. Comparing this to conventional ICSI with a fertilization rate of around 70%, then a 55% blastulation rate, you will end up with less embryos. So this video actually just summarizes um, the points I mentioned earlier. Okay, so in summary, Piezo-ICSI is a gentler form of ICSI that uses a blunt pipette and does not deform the oocyte. It evades the aspiration of the ooplasm during the procedure, which reduces the risk of damage to organelles and the cytoskeleton within the ooplasm. Piezo-ICSI appears to improve fertilization rate, blastulation rate, and diminishes oocyte degeneration rates. Piezo-ICSI can lead to increased number and more good quality embryos. And in women with poor prognosis, Piezo-ICSI shows some evidence of increased implantation, pregnancy, and live birth rates. I would also like to acknowledge the work of our embryologists from Singapore and KL for sharing their work with us. And if any of you is interested in finding out more about the technology and if you want your patients to benefit from such a technology, I'm happy to announce that we'll be opening Alpha IVF Manila in November where you can find Piezo-ICSI. Thank you and good morning.